communities are crucial, and we need to meaningfully engage them in all aspects of our work, from beginning to end.
Communities have always possessed this capacity to address their own health issues. COVID-19 simply shined a light on just how important it is and how powerful communities can be in involving them in finding solutions.
SEAL, spelled with a C, stands for the Community Engagement Alliance. This is an NIH-wide program that was established early during the COVID-19 pandemic, when a couple of things became very, very clear to us. First, there was a huge disproportionate impact of COVID-19 cases, COVID-19 hospitalizations, and COVID-19 deaths in underserved communities, especially in racial and ethnic minority communities. Second, these same communities also had very low levels of trust in science, coupled with high levels of hesitancy for proven effective vaccines, therapeutics, and community mitigation strategies. The mission of SEAL then and now is to provide trustworthy science-based information through meaningful community engagement and bi-directional outreach to the people who have been hardest hit by the COVID pandemic.
Through that process, we did see decreases in vaccine hesitancy, a greater propensity for uptake of vaccine, and a lot of other types of successes through the SEAL Alliance.
The SEAL program is a very innovative program and very important program because it addresses a key issue in public health, that is the engagement of communities in different aspects of research and also policy. And this is a domain that is still in development, and NIH clearly has taken important initiatives such as SEAL and other in order to respond to the pandemic and the crisis. And the journal has tried to adapt to that situation and also find ways to publish this material.
A lot of the issues we were seeing had to do with trust. And so the partnerships that evolved aim to foster trust and trusted partners that could begin to work side by side with researchers to advance research questions, approaches, analyses, answers in a way that truly provided meaningful engagement in communities in resolving a lot of their own health issues.
With the end of the public health emergency back in May this year, we can now take the lessons learned from the COVID era and use meaningful community engagement, community participatory research, and dissemination and implementation research approaches so that we can address these root causes to make sure that all persons, all individuals in all communities can live fulfilling lives to their best potential in thriving communities.
It's a series of articles, and all those articles shows how public health has been acting in order to reach so-called hard-to-reach and minoritized communities. What those supplements, in particular the one that we are publishing with the SEAL group, shows what type of work has been done to reach the most difficult community that are, for different reasons, isolated or marginalized or minoritized, and that richness has been captured in this supplement.